Hey, what's up guys, it's Matt with the Movement System. I'm here with Dr. Zaki Afzal at Optimize PT and Performance here in Las Vegas, Nevada to answer your questions about what it's like to be a sports physical therapist. We have 10 questions that we're gonna ask Zaki and get his opinion on what it's like the day-to-day life of a sports physical therapist. Let's go ahead and dive into it. All right, first question. What's a day like as a sports physical therapist?
So in my life, I'll kind of go through that. It's different person to person, but for my life, basically wake up, get to the gym, work out, and then I get to work. So I'm the owner of the company, so I'm seeing about probably 4 to 6 people a day. Our clinic's a little bit different, so each person is one-on-one for the entire hour. I might start with a professional football player, move on to a CrossFitter, then maybe with a firefighter, then maybe a runner, but those are the kind of folks we work with are active adults and athletes. So we see our folks, we make sure that we have their home exercise program for them. We make sure that we upload their programs on the app that we have, but we have a pretty unique model. So a normal, let's say a physical therapist that I've employed here, we'll see anywhere from like 6 to 8 patients a day, and kind of the similar thing where they do one-on-one for an hour.
Okay, so I know your role has changed through fellowship, residency, you've done it all and been in a bunch of different roles. So what can someone expect right out of school as they're just getting into the field of sports PT versus 5 years, 10 years down the road? How might that change?
So when you're first coming out of school, one thing you should expect is not a ton of jobs that are going to be exactly what you want. So right out of school, a lot of people think they can just jump in and start working with professional athletes, college athletes, things like that. Those jobs are very sought after. You're going to have a lot of competition, and generally people that grab jobs like those aren't giving them up really easily. They'll work their way up the ladder. So that's one thing to expect is start networking while you're in school, because that's going to allow you to have more opportunity for those jobs when you get out. As opposed to 5 to 10 years later, a lot of people think, if I get this certification, that certification, take this course, do that thing, it'll make me more marketable as a professional. I get those jobs, and that is true, but really what's going to get you in the position of that dream job that you want in sports physical therapy is your network. Making sure you leave good impressions on everyone you meet, make sure you ask good questions, make sure you're taking the time out to really seek out the folks you want to be more like and be in the same position of, and see will they give you advice, or not just asking for their time but giving something in return. So in general, what I would say, what people usually want is working with pro athletes, college athletes. It's a very limited number of jobs that can be there, so make sure you're willing to work your way into those jobs.
Makes sense.
Yeah.
So let's back up a little bit to the education side of this, because you may be in high school and just thinking about this, maybe you're in college and already pursuing a different career, maybe you're pivoting to this career from something else. So what was schooling like for you to become a sports PT?
So, came out of high school, went straight to college. You got a 4-year degree to bachelor's. Most schools require you to get a bachelor's to apply for physical therapy school. So applied, got in, and then did 3 years of a doctorate physical therapy program, which is going to be, first year is going to be your basic courses, your neurosciences, your anatomies, your pathophysiology, things like that. Second year is a little more specific into physical therapy, where, you talk about exercise, you talk about cardiovascular exercise, strengthening, learning about things like that. And then third year is usually mostly rotations in person, right? So we go to outpatient clinic where you work in maybe sports, right? Then you'll go to a hospital setting, then maybe a skilled nursing facility setting. So you get experience in each one of those. And then you graduate, and then you get to take your board exam, and then from there you can look for jobs. So that's kind of what the schooling was like. For me specifically, after I came out of physical therapy school, I did a residency in orthopedics, and I did a fellowship in manual therapy and sports. So those in the physical therapy field are optional, as opposed to, say, the medical field, where a residency is mandatory for you to work in the field you want. So I would say if you're really looking to get as good as fast as possible, a residency and fellowship are options there, as long as you do the one that's right for you.
Makes sense.
Yeah.
So can you just give us an idea, like roughly from your class, how many people had done an undergraduate degree in a related field like exercise science, kinesiology, biology, versus how many of them had studied engineering or dance or something completely unrelated, but then pivoted and still got accepted to the Doctor of Physical Therapy program?
I would say in our class, it was probably about 75% of people did a related degree. I mean, myself, I didn't really do a related degree. I got a degree in psychology. And to be fair, like to be honest, what it was I wanted the fastest route to be able to hit my prereqs and the cheapest route to be able to hit my prereqs and still get a degree that I needed.
Yeah.
Because schools are mostly looking at your prerequisites for physical therapy school, right? So each school is going to have a different list of courses, but the core 80 to 90% of those are going to be the same. So if you do well in those, you get a good GPA in there. Really, the degree, I would say, it matters in terms of giving you the prerequisites and the right amount of knowledge to make you successful in physical therapy school. But I think most schools are looking to see if you have the prerequisites and then have the degree on top.
Yeah. Yeah, and I'll say from my experience too, like probably similar, like 60-70% of the class that I was in at Ohio State had done an undergraduate degree in exercise science or something similar, but there was a good 40% that had something completely unrelated. Marketing, business, engineering, dance, something completely unrelated, but still got their prerequisites in, applied, and they really weren't at a significant disadvantage through PT school because once you do the prerequisites and you get into school, you pick up on it. So even if you're pivoting, don't worry about it too much. A lot of people would do that and make it just fine. Mm-hmm. Okay, so next question. What is your favorite part of your day and least favorite part of your day as a sports PT?
My favorite part of my day is seeing my team. Definitely that's definitely my favorite part of the day. I feel like we've compiled just like, a team of killers, but also a team of people that just are fun to be around, fun to work with, people I call friends. So that's definitely my favorite part is to interact with them and have the environment that we when I first started the business, I kind of wanted to have like a barbershop type environment where everyone's, talking smack here and there. Everyone's kind of involved and making it a very happy, kind of upbeat kind of place. So that's definitely my favorite part. My least favorite part is dealing with, we don't deal with a ton of insurance companies. Actually, just one, really. So dealing with them is probably my least favorite part of the day. And the admin side is something that, is always something that can get better, always something that can get more efficient and cleaner and more organized. And organization is probably one of my weakest areas as a person. So luckily I have a great team to help me with that. So that's probably like my least favorite part.
Gotcha. I know just from doing clinicals during PT school, that was, and coming back and everyone talking about their clinicals, the atmosphere of the clinical is really what makes or breaks it. Actually, can you talk about like what is clinicals? For anyone who doesn't know, like what's a clinical or a clinical instructor, a CI? Yeah. What's that like during PT school?
So basically, and I can give perspective from both the student side and the CI side. So basically what it is, you jump and do on-the-job training, right? So you jump into a clinic or a hospital system or a skilled nursing facility and you jump in and you get the training like a normal employee would. And then you spend anywhere from, some schools have 4-week rotations all the way up to 16 weeks, right? So depending on which part of schooling you're in. And then from there, you get paired with a clinical instructor who's basically your mentor through this entire time. And your goal throughout this, especially in your last year, is to be able to build up to a full caseload of patients like you would have if you were actually working there, right? Obviously, you don't get paid for these, so that's something to keep in mind, but you're there to learn, but also kind of be tested in would you survive and would you be able to thrive in this kind of work environment, right? So as a student, what you have to remember is you have to go into this with an open mind. You have to go into this, even if you want to go into sports and now you're in a hospital rotation, you have to go with the open mind and understand that, you're trying to learn as much as you can, and even though if you're very fixated on sports, you still can learn a ton from these different places and different people in these rotations. So leaving a good impression on your CI and on the admin, the bosses, the people up top is going to be very good, especially if you plan to eventually live in that area or work in that area afterwards. It's very important. From the side of the CI as a clinical instructor, basically what I'm looking for in a student is someone asking good questions, someone willing, and it doesn't mean you have to show up early, stay late. I don't think that's really what I'm looking for as a CI. I think that does show initiative, but I don't want someone working themselves into an early grave, right? What I want is while you're there, you're very involved, you're very thoughtful about your questions. You're sitting there not just worrying about, when am I off, when am I leaving, is how much can I get out of this, right? Because I think one of the things that's a big shock in physical therapy school for a lot of people is how little you're spoon-fed and how much you're actually expected to learn on your own. And that even goes further during your clinicals, because if you're not there and picking up things on your own, doing your own reading, asking questions that come from, second and third layer questions, which means, not just asking, oh, why are you doing this? Thinking about why this person is doing this technique or this evaluation. And then from there, going to the next level question, okay, maybe I do know why they're doing it, but what's their process? Why did they choose this over this? Those kind of questions are important. So I would say clinicals are where you kind of develop actual clinical skills, whereas, you get to actually put into practice the theory you learned in school.
I see. Now, if you're going to PT school, do you go to sports physical therapy school versus a different type of physical therapy school, or how does that work?
Yeah. So certain physical therapy schools will have certain clinical affiliations, meaning that, they might have access to bigger sports clinics to send you on rotations or something like that. But in general, I would say 90% of physical therapy schools have the same opportunity as every other physical therapy school. So there's no specific physical therapy school. The whole goal during PT school is to get you to pass the board exam, right? Because most schools are judged based on how much first-time pass rates there are from the board exam. So they want you to finish the coursework and pass the board exam. And then the clinical opportunities, there's some schools that let you make your own. Like where you can put them in touch, hey, I really like this clinic, it's in an area I like, they have the patients I like working with, they have a clinical instructor that might be really good for me. Can you make a connection there and get me to do a rotation there? There's opportunities like that as well. So always asking about that during the application process, the interview process is really important. So no, there's not a specific physical therapy school that does specific things, but certain schools will have more opportunity for you. Like, I think the #1 rated program in the country is USC over in California. And I think the ability for them to have a network that can allow their folks to have the opportunities in research and have the opportunities in clinical practice are a little greater than, say, like, a private school in some other state and city. So something to look at, but you're usually paying for that experience as well. So
yeah. So basically you get a general degree and then you specialize a little bit in your clinicals, but then more so afterwards.
Yeah.
How can you decide, if you're thinking about being a sports PT, how can you decide if that's right for you rather than an athletic trainer or a personal trainer or a strength and conditioning coach or some other field that's very similar?
Yeah. So I would say the biggest thing that differentiates us and like strength and conditioning coaches is usually the medical side of things, right? We can technically diagnose certain kind of conditions. We can work with people, straight after post-op. Some strength and conditioning coaches do that as well. But we're generally the people that are thought of for the rehab side. I would say if you're looking at either one of those kind of career choices, you have to weigh a lot of different things in your mind, right? So how much school are you willing to do, right? So I also have my CSCS, so that's something I studied for a couple weeks and took the exam and passed it. Versus VT school, you have to go to a 2 to 3 year school to be able to go through that. And not only do you have to pay a lot of tuition for that, but you also have to, the opportunity cost of spending time in school and not building up your caseload as a strength and conditioning coach has to be thought of as well. So kind of where you are at in life and where you want to end up at. If my goal was just to work with athletes, then I would probably stick with the S&C side and see what I can kind of get there. Or athletic training. Athletic training is a bachelor degree, and they also work in a rehab. But they're generally more invited and accustomed to the locker room a little more compared in sidelines compared to physical therapists, which are mostly in clinics. So my thing would be, where you want to be, how quick you want to be where you want to be. Do you want to be working with athletes? Okay, do you want to spend 3 years in school, or do you want to start working with them now? 2, what's your financial situation like, right? So personally, I came out of physical therapy school with $150,000 to $175,000 in loans, which is pretty big. And I don't feel like I was very educated or informed on that before I made that choice. So something to definitely look into. Whereas, if I take my CSCS, sign up for the course and do it, that's way more affordable. And then probably 3 is, do you really want to be on the medical side of things or not? Do you just want to be on the S&C side, right? And take a little bit less responsibility, a little bit more focused approach to the strength conditioning world? Or do you also want to take people directly from their injury all the way through the spectrum, right? So that's kind of what we do here. So a lot of different things to kind of consider. But at the end of the day, I think those are the most important.
Yeah, I know we were talking a little bit about this before, like seeing the way actual people are working in a clinic, in a gym environment, like going and shadowing and seeing that beyond just like the statistics you read online. the average salary of this, the average salary of that. Actually going and talking to people who are doing it can be really helpful. Because I mean, you have people here who are sports PTs and who are excelling with that, but then you also have people who are more on the strength and conditioning side and are doing great and taking on really complex cases and things like that as well. So.
Absolutely. I think at the end of the day, it's just a piece of paper that tells you what your scope of practice could be. It doesn't tell you exactly what you have to do.
Yeah, and I hear sometimes from people that they just want to open more doors and give themselves more opportunities. You can do that with school, with PT school, but you could also do that on your own, just like going to talk to more people, making bigger networks, things like that too. So definitely, weigh the pros and cons, look at what people are doing.
Absolutely.
All right, next question. What types of tests do you do on athletes?
So in general, most of our athletes, we do range of motion tests that are pretty normal, both actively them moving themselves or passively them laying on a table, us moving them, just to get a good picture of their overall joint health, where they're limited, where they're not. We also do quite a bit of functional tests. We'll take a look at someone's squat, their hinge. We'll take a look at a push and a pull. We'll take a look at running mechanics. We'll take a look at sprint mechanics. Generally, most tests that are taught in like physical therapy school, they're made more for the general physical therapy population and not necessarily for the athletic population. The athletic population actually does a lot better with strength conditioning tests than they do with physical therapy school tests, as at least what I got in my education. So, we'll take a look at their vertical jump, their broad jump. We'll take a look at, sometimes 1 rep max strength. We'll take a look at, like a leg extension if they're maybe post-op ACL. So it really depends on the context of what you're seeing this person for. But at the end of the day, the tests should most closely mimic or have some kind of quality that they'll need on the field or on the court or back in their jobs, whatever it is. Those are the tests you need to be doing that are the most valuable. And not all the tests are standardized where they're like, oh, this is the normative data, this is what they need to be at. So that's where experience and knowledge kind of takes you, right? So if I do a vertical jump test on, say, a wide receiver, there's no like a typical wide receiver vertical jump average I'm trying to get them to do. I'm just basically testing them to see, are we going in the right direction? If I retest it, is it better or the same or worse, right? So it'll tell us which direction we're going in.
Gotcha. Yeah. All right, question everyone wants to know. How much money can you make as a sports physical therapist?
Okay, so you can make as little as $50,000 a year, and that's in, New York is generally one of the lower paying cities. Colorado doesn't pay very well. There's a couple states that generally pay a little bit less. So you can make as little as that, or you can make as much as over $1 million a year if you become a business owner that's very successful, right? So it really is up to you in terms of where you chase, right? So in terms of like we talked about, that piece of paper tells you what your scope of practice is, what you're allowed to do. It doesn't tell you exactly what to do. I know other physical therapists that didn't even treat a single patient coming out of school, and now they're working at helping other business owners learn how to market and from a physical therapy standpoint, right? So really the sky's the limit, and luckily the floor isn't super low. The floor is definitely higher than the average salary of a person in the United States. Yeah. So it's definitely higher than that. But it all depends on how much value you bring to an employer or value you bring directly to a client. And that's what's going to dictate how much money you can make. And I know this is a very broad answer, but sure, yeah. That's really the truth. Like, for our physical therapists, the goal is for them to get into 6 figures as quickly as possible, and then have routes to make even more. Whereas other physical therapy clinics that are more your typical outpatient clinics, they have like a standard set where every year you get like a 1.5%, 2%, 3% raise or something. So that there's all kinds of different worlds for that, but that's generally what I see.
All right, last question, and this one's really personal to you, Zaki, but what are some of the things that you've done in your past, whether that be through school or through your experiences and networking, that you've felt like were really worth the time and that you would really encourage people to do? And where do you see yourself kind of going with that in the next few years?
Yeah. So one of the things that I think that helped me the most, which I wish I would have started earlier, like you said, was networking, getting out to meet people. And that doesn't mean you have to go to your local business chapter and go to these weird meetings where you just talk about the weather. I think getting out to meet people means like, being vocal and letting people know what you do in the gym you're at. Maybe, in your recreational sports league that you're in, talking to people there, letting them know what you do. It's basically just making friends, but then now you have the identity of a physical therapist that people can lean on for advice and possibly services in the future. So I think the networking aspect was something I wish I started earlier. For example, I didn't start any of it in school. I eventually ended up moving back to the same city I went to school in and basically starting fresh. So if I had the ability to go back, I probably would have started that during school, going out to meet people and making good connections that way. So I would say, don't worry too much about, networking events. It will happen candidly once you're able to give value to somebody, right? It's more about, when you make these relationships, you don't want to be that person who just goes around asking for stuff. You want to be able to deliver value. And then when you make an ask to somebody, it's a no-brainer that they want to help you out. Right, so that's what I think helped us out a lot. Where we want to be in the future is right now we're in like a 3,600 square foot facility, which is awesome. It's a really great clinic, but I want to be in like a 12 to 15,000 square foot clinic. That's hopefully in the next 2 years for us. Half court basketball court in there, full training room, probably standalone building, have a strength conditioning staff in there, massage staff, possibly a nutritionist. We want to have sports medicine physician possibly working in there, doing blood work, hormone rebalancing. Just kind of the slogan we're probably going to make in the future is we're the A to Z of PT, right? So we want to take care of people from beginning to the end. And that's like in filling in all the blanks that were possibly missed. So hopefully in the future we're working more and more with folks that are very serious about their health and in a beautiful kind of headquarter facility.
Nice. One thing I've learned just networking with you is like your energy just like goes out to people. Like that's honestly like what's helped me. Like me come in here and like want to like be around you guys, and like I'm sure it's like other employees and clients. It attracts that, like, right. So the energy you put out is kind of what comes back to you.
Absolutely.
So not always right away, but over time, just keep putting out good energy for people and treating them well, and you'll build something like you did.
Absolutely.
Thanks for the interview.
Of course.
All right, guys, thanks for listening. If you guys do have any questions, go ahead and drop them in the comments below. If you want to check out what Optimize is doing, head over to optimizeptp.com and you can check out all the stuff about Optimize there. Thanks so much for watching, and we'll catch you in the next one.